Okay. No, I have uploaded. I have uploaded the last one because it is the same file, right? The file which was for ECG now. So if you really see that, so it was only on one file which we were working. So it has got about more than 40 plus pages. So in one of the lectures we completed till 20 pages, and then in that file only we continued. So that's why you will find that file is same, but still let me check. Maybe if it is my mistake, let me. Again, it has been like there is overlap of timings, so we have to change the timings. Let's see. Oh, yes, that file is there. October 19, right? I have uploaded it on October 19. So 19 was Saturday. 21. Yes. Yes. So it is there. Okay. I have uploaded it. Yes, that's what, because I have been sent the schedules of the lectures of the university and they are overlapping badly. So it is coming like how many of us are here? About say 80, 100. So just let me know right now. Are all of you in India? Okay, let's change. Let's ask it other way around. Anyone who is not in India, because there were more than okay. So most of you in this. Okay. One more question. Is anyone having this timing problem, that means Tuesday, Thursday, and Saturday, if we are keeping at 5:30 to 7:30? Is this time not convenient to anyone? If it is convenient, then don't write. Don't write. If it is not convenient, then and then. Akshat, I couldn't get you. Yes, only on Saturday means what? Means is it convenient or not convenient? Okay, Akshat, having problem on Saturday. Okay, Arohi, no means this time is not suitable or it is suitable? Not suitable. Can you just specify the reason? It should not be the personal reason. Is it overlapping with any of the lecture or anything? Because only 4. Time means no. What's the problem? Write down the problem also. I mean, there are 4 friends, right, who are having problem. But okay, university lecture on Saturday. No. What I'm asking is, Morning lectures are good. Even I feel like I'm happy in the morning hours, but no worries. So many students, they were having lectures, university lectures overlapping. I'm asking for the evening time. If there is any personal reason, to, I'm really sorry, we can't manage it, right? Because then none of the time would be convenient to anyone. Kahin na kahin, kuch na kuch, there will always be overlap. So no hard feelings, but sometimes when you say I had to go for some marriage or this, that, but so it is difficult for me to adjust to everyone. You know? Afternoon is difficult. Afternoon timing is difficult. And afternoon to Sharon, it is like almost every day there would be overlap in afternoon. As I saw the timetable, afternoon, so it is either we have to say this was the only solution, keeping it on Friday, Saturday, and on Sunday. Chirag, for the physiology, you can buy Guyton or Sambulingam. Guyton is like my favorite book. That's why I'm telling Guyton. Otherwise, there are very good books. And for anatomy, to start with, go for VD Chaurasiya. There are 4 volumes. Take all 4 volumes. You will be needing it. So, okay. All right. So I think you must have noted the name. At least for today, we continue with this. Another thing, say those who have joined very recently, that means it's very humbly and in a very nice language, what you wrote is that yes, it was, if last lecture was your first lecture, so then yes, it is difficult to understand the ECG straight away if you are attending it. So that's why keeping everything in mind, and there are several such emails I received. Yes, that's right. And it is very good on your part that still patiently you attended the whole thing. Good. What I'm doing today is, we are going for fetal circulation and we are going in depth with the fetal circulation. There are 4 reasons, right? 4 reasons why we are taking fetal circulation. One, because our next lecture would be the congenital heart disease, right? Where we'll be starting with the embryology. Right? And then from embryology, we'll be learning both the diseases, one which is called as the cyanotic, in which the baby will become blue, and other is non-cyanotic, when the baby will not turn blue, but baby's growth would be stunted, right? So that's why it would be very important from the clinical aspect. That is when your decision, because what would happen from the patient side? Patient's parent, right? Because that baby is your parent. You'll be able to understand fully and completely today's session without any problem, but don't miss today's session. Even if there is doubt on one point now, do let me know. Else, it would be very difficult for me to take the next time onwards, right? So what I was talking was cyanotic. Cyanosis means blue. Baby becomes blue, right? And non-cyanotic. Non-cyanotic means baby is pink, normal, right? But baby's growth is stunted. Baby will remain small and small, right? Or its mental growth will be affected. So we'll be learning both these things, but the foundation will be today's session. Then the next important would be when the patients, that is baby's parent, they will say, Dr. Saab, will my baby will be fine as the age increases? Now that is a very crucial thing. In some cases, you have to be blunt, right? You have to tell them that what can really happen. And in some of the cases, you can say very confidently that don't worry, everything would be fine, right? It's a very big thing, but you can't bluff because it is a matter of someone's life, right? So that is one. Another thing is, if you say that yes, this is a difficult case, and the next question will be, what can we do to correct it? And in some cases, the cost would be pretty high. So I'll be showing you even those things, that is, how much would it really cost, right? What is the risk of that surgery? Once you understand this thing whole as a unit, because that would be like our intention till we finish, right? Till we finish our entire studies, till the end. So what I was telling was that how things would be going. So what I was telling is how things would be going is that we'll be learning the whole thing as a one topic, right? So that we'll be covering everything whatsoever is under that. So with this intention, we are starting today and what's called as the fetal circulation. Fetal means when the baby is not born, when the baby is into the mother's womb, right? So at that point, how the circulation would start, right? So that is what is called as the fetal circulation. Because this baby, this is the final output. Once he or she is born, so then what would happen, right? But to bring this smile on his or her face, right, there would be several stages and we'll be going right from the beginning till the end. So let's start. So when we say about fetal circulation, right, circulation means we'll be dealing with two things. One is the heart and second, the blood vessels. Right? That completes the whole thing. And when we say blood vessels, then it is about arteries and veins. Easy? There won't be any Q&A. Let me be clear. There won't be any Q&A session at the end. Right? You can ask question at any point. You can just message. If the question is very critical, I'll immediately answer it. If it is like that, I'll be integrating. If it is possible to integrate it, I'll do that. Right? But don't keep on writing same question again and again and again. Right? On the screen only, the chat is there. So I'll definitely read it and I'll try to incorporate it into our discussion. Right? But yes, you can ask any time. Right? Any time. Don't wait for others. Our purpose is that more than 100 friends, but everyone should be crystal clear about every step of the fetal circulation because this will be the foundation. Okay? So hope everything is clear and let's start. So this is the circulation, which is a normal body circulation, right? Heart and blood vessel, that is what we'll be talking about. And when we say blood vessel, that means arteries and veins, right? When we say arteries, so that means any vessel which is coming out of the heart. So that is artery, and what is getting received by the heart, that is the vein. Our normal thought process is that things which are going out of the heart, they are oxygenated, and things which are coming to the heart, they are with carbon dioxide. Normally, it is right, but over here, we'll be changing this concept slightly. So here is first, let's start with, say, that's our, right? That's our heart. So this is the left atrium, right ventricle, left ventricle, and this one is aorta. In general, we are writing it like this. This is aorta, and here is the body. Right? When we say body, that means it is upper limb, lower limb, head and neck, everything, right? Because aorta would be dividing into carotid and it will go up, and then that aorta will go down into the form of thoracic and abdominal, and then it will divide and it will give lower limb. But finally, it is to the body. Yes, it is carrying oxygen, right? Then body will be utilizing it. So we'll be changing the color. Body will be utilizing it. Upper limb, lower limb, head and neck, from everywhere the blood is collected and it will be going into the right atrium into the form of superior vena cava and inferior vena cava. So this is having carbon dioxide. From here, this is the tricuspid valve. Right? This is the tricuspid valve. It will go to left ventricle. From left ventricle, it will go out. Right? Anything which is going out, so that is called as the artery. So this one is the pulmonary artery. Right now, we are writing artery. Right? In fact, it is trunk, right? It is quite thick. Those who have attended all previous lectures, they know that it is the trunk and then that divides into right and left. But right now, just keep it pulmonary artery. Pulmonary artery will be going to lungs, right? Right lung, left lung. But finally, it is to lungs, correct? From lungs, again, it is oxygenated. So there would be the gas exchange, oxygen, carbon dioxide exchange, and this oxygenated blood will be going into the left atrium, and that is the oxygen. So these will be the pulmonary veins because they are getting received by the heart, right? And then there is the mitral valve, and circulation continues, right? No doubt. It has to be like this, right? Left ventricle is much bigger than right ventricle, but this is schematic. If this is clear, we add important points into this. Left atrium, left ventricle. This left ventricle is a high pressure system. And right ventricle is a low pressure system because lungs are delicate. That's why the circulation which is by aorta, it is called as the systemic circulation. Right? It is called as the systemic circulation because it is going into all the systems. The things which are going, the blood which is going into the lungs, so we'll be calling it the pulmonary circulation. Right? So in our body, as such, there are two types of circulation. These are the circulation. Always remember the blood pressure which we take, right? So when we say it is 120 by 80 millimeter of mercury, you are talking about systemic circulation. So this is the systolic, right? Systolic blood pressure. Many of the things are repeat for many of the friends, but this is keeping in mind for those who are attending for the first time, right? So systolic and diastolic. Systolic means when the heart really contracts. When the heart contracts, it is the blood which is thrusted, and that is the 120 millimeter of mercury. Mercury, which is 13.6 times heavier than the water, right? So that's the reason, because this pressure is so high. If you keep a water column, then the sphygmomanometer, the blood pressure measuring instrument, has to be of the size of the ceiling, right? Right now, please, no other questions, because it was a very good suggestion to both of you. Really thankful that sometimes in answering other questions, the link is broken. So that's why any of the question which is not related to the topic, I'll be skipping it. We'll be answering it at the last. Okay. So this is, don't feel bad, but this is the thing. Diastolic is when the heart is relaxing. So this is the minimal load. Technically speaking, whenever you will be dealing with a medicine, whenever you will be dealing with a patient, you take the blood pressure, and if someone's blood pressure is, right, we have got the two patients. One's blood pressure is 148 by 84 millimeter of mercury. There is one more patient whose blood pressure is 136 by 92 millimeter of mercury. This is more dangerous because its diastolic is more. Diastolic is like a constant load on the heart. Right? It is like a constant load on the heart. So this is more dangerous. So just to keep in mind that it is the diastolic pressure which is vital as compared to the systolic pressure. Right? Systolic pressure, so you just have a cup of tea, coffee, it will come up. Diastolic won't be increasing that easily. But if the diastolic increases, yes, it is exactly like that. If you are running and someone puts 10 kilogram of sandbag on your shoulder, and now you are running, right? So this is like a constant run with that pressure. So this is that. Okay. Now we talk about the fetal circulation. So here is now the baby. The moment we change the whole scenario to this is that baby which is breathing, which is live into the mother's womb. And how is the situation? The situation is that in the womb, that baby into that fetal position, right, smiling, but the whole thing, this whole thing is in water. The whole thing is in water. And that water, that is what is called as the amniotic fluid. Amniotic fluid. So though it sounds a bit crazy, but baby swallows that amniotic fluid, it goes into its GIT, baby excretes that fluid, and again that same fluid is circulated. Right? So this is the situation. Now in this situation, those lungs which are over here, right, lungs which are over there, those lungs, so they are dipped in water, so they can't breathe. So in this circulation, take this factor out. Baby can't breathe. Right? Baby can't breathe. Because lungs, they are soaked into water, right? Fully into water. So that's why there has to be some system by which the baby should be able to breathe and run the whole show, because he has to really grow, right? So here is the thing. So here is that baby, right? And here is the mother, right? Whatever the oxygen which mother breathes, that is the oxygen which is given to the baby. And in between, it is called as the placenta. So there is a barrier between, so that blood comes here, and from here it goes there. This placenta, it is also called as the barrier, right? Barrier. It is between mother and the baby. When we'll be studying pharmacology, many times we'll come across that this particular medicine can cross placental barrier. This particular medicine, it cannot cross the placental barrier. So the importance would be this. If you are giving, if it is necessary to give some, say, drug which is related to CNS, central nervous system, right? Or if it is a CNS depressant, right? Some anxiolytic drug, alcohol, right? All those things, they can cross the placental barrier. When they are crossing the placental barrier to this particular baby, which is already very delicate, right? Things are getting developed. Growth, right? It is in the process. So that particular insult, which is not a mother but will affect the baby drastically. So that's why when we'll be learning pharmacology, this is like a groundwork that we'll always be talking about whether it can really cross the placental barrier or it cannot. Right? So this is the importance. Because let's say if you are doing post-graduation in gynec obstetric, so then this topic will be coming. Or even in MBBS, even in Viva, it comes that, okay, you're talking about one particular drug, let's say in pharmacology, so then it is asked, can you give this drug to a pregnant lady? Now that is crucial. Right? So what your teacher is trying to ask you is, are you knowing about whether it can cross the placental barrier or not? Right? Simple as that. Okay. Next point. What we are now about to discuss is that before birth, what to do for the oxygen, right? That's crucial, because after birth, it is the independent breathing, though not very efficient initially, but you'll be surprised that at what level, right, the baby adapts himself or herself and then goes for the independent breathing. There is a major change, right? And when this thing occurs, it is the first cry. It is the first cry. That is the reason that when the baby is born, right, within 1 minute, if the baby is not crying, so on her hips, right, give a sharp slap. Because that slap, right, जोर से खींच के थप्पड़ मार. So no problem, because there was one very amazing sentence which I read. I read it just 2 days back, when a question was asked to Abdul Kalam that can you define mother? Who is mother? What he said is that mother is the only person in the world who is very happy on the cry of the child when the baby cries for the first time. But after that, never. Right? So this is that true. because it is this first cry. That first cry, it literally opens those lungs, opens the lungs. If the lungs are not open, right, then there are some severe complications which we'll be understanding as we'll be discussing the conditions, right? And then you have to exercise, there are scores you have to evaluate, right, which really tells that the baby as it will grow, what will be its maturity. If more than 3 minutes have passed, then yes, you do expect that there would be some gulbad, there would be some locha, there will be some problem into the development of the brain. Right? So that's why those minutes they are so crucial. Isliye no harm, right? Bindas, right? That first slap, it is necessary. Okay. So now we start our journey with one small piece of anatomy which you must know. Right? This is from the shape itself, you must have guessed this is liver. What liver is doing? Liver is the most selfish organ. Right? After brain, brain is first. Then brain tells, do hell with the rest of the body. I need my oxygen. I need my glucose. So he consumes glucose and oxygen maximally. Next comes is the liver. Liver tells, I am the person who is metabolizing it. Right? Metabolic. This is like our chemical factory. So the reason we call it as our chemical factory, because whatever we eat, it comes over here. Right? It comes over here, and that is what is called as the portal circulation. Right? It is called as the portal circulation. So here is the spleen. Right? Here is the spleen. Spleen is one of the important organs for lymphatics. Right? Lymphatics, which fights our immune system, right? Which is like an important part of our immune system, which fights against all pathogens. Now there is a vein which is called as the splenic vein. Right? So here is the splenic vein. Right? I'll just write it. Splenic vein. Stomach, 4 parts of duodenum, first part, second part, third part, and the fourth part, right? Fourth part, which is retroperitoneum. And then there are small intestines, right? I'm drawing small, less, but they are more full of it. And then over here, it is called as the cecum, right? This one is appendix. Right? This one was stomach. This one is duodenum. And then we have got this jejunum, ileum, and then there are all the way, these are the large intestine, that is, they are called as the colon. So we have got the ascending colon, it is called as the ascending colon which is going up. Then we have transverse colon, right? It is called as the transverse colon. And then the descending colon, right? And the descending colon, which goes down. Descending colon. And then there is sigmoid colon, right? Sigmoid colon and the rectum, right? So this is the sigmoid S-shaped. That's why it is called as the sigmoid, right? Sigmoid colon, then the rectum, where all the feces, right, there, and then the anal canal. This is the whole digestive system, right? On top of it, there is liver, right? There is liver over here, and the spleen on the opposite side. So liver would be overlapping liver, and the spleen would be on opposite side. So liver and the spleen. Right? All this, whatever we eat, as it will be going into these systems, right? There will be vessels which will be absorbing it, and then everything is sent to the stomach for the processing, right? For the processing, because it is the stomach which processes everything. So that's why there are major vessels, and the vessels which will be over there, they are called as the mesenteric, right? So They are called as the mesenteric veins. So there is one vein which is over here. There is second vein which is over here. This one is called as the inferior because it comes from the lower part. So it is called as the, and for mesenteric vein, we'll be writing MV. So there is inferior mesenteric vein, and then there is superior mesenteric vein. All these three, they combine and they make one vein, which is big one, and that is called as the portal vein. So it is this portal vein. It is this portal vein which takes the entire food, right, into the liver, and then the chemical processes start. So our protein synthesis, carbohydrate synthesis, whatever it is eating, right, everything is analyzed, synthesized by liver. And then liver would do what? Liver would, the crux of it, right, something which can be absorbed and it can be utilized by rest of the body or the tissues, that is sent out, right? And it is dumped into what? It is dumped into inferior vena cava. Right? So these are the hepatic veins. Hepatic means liver, right? So these hepatic veins, they will be landing into the inferior vena cava. Why we are discussing this? Because the mother's blood will be making an entry into this route and it will bypass it, right? So, so interesting. So from liver, things that food and everything, nutrition and everything that would be put into the inferior vena cava via hepatic veins, because baby can't eat. So nutrition will be coming via mother, oxygen will be coming via mother, and everything has to be distributed, right? So there has to be a classical, beautiful mechanism so that everything is to be said. And from inferior vena cava, things are easy, right? From inferior vena cava, it will go into the heart, and from heart, it will go into the entire, to the body, and it continues, right? Because from inferior vena cava, it will go to the, say, right atrium, to right ventricle, to lungs, to then it will go to the left atrium, to left ventricle, to the body, right? So it goes. So things are circulating. Okay. We are adding one extra thing into this. This one. Liver is like a, the way we said that heart is like a cashier. Heart is pumping. Right? Mesenteric veins, they are all those veins, right? All those veins which are from this digestive system, right? They will be carrying, right? We have got the superior mesenteric, inferior mesenteric, all those veins. So those mesenteric veins, they carry. So we can just write it like from digestive system, right? So it will make things easy. From digestive system. Right? So now you are smart enough to know that from digestive system, whatever the things which are eaten or consumed, everything is coming over here for the liver. That's why, you know, in one of the movie, when Amitabh Bachchan said, "Daru peene se liver kharab hota hai." That's the thing, right? Because that alcohol will be coming over here. Blood coming from portal vein is oxygenated. About to say that, right? So, the thing is, sorry. The thing is, when we said that heart is like cashier, you know, heart is working. Any amount of blood which is passing through the heart, but heart cannot use it. It has to be via that coronary circulation. So that small amount of blood, whatsoever is given to the heart via coronary circulation, with that blood, heart keeps on working. Same thing is over here. Same thing is over here. From heart, right? From aorta, right? From aorta, here comes, right? Aorta is big boss, right? Very close to liver, right? I'm just drawing it far, otherwise aorta is very close. Right? So this aorta, it sends one branch, and that is because it is from heart, out from the heart. So we'll be calling it hepatic artery. And yes, this is oxygenated. Because this blood from the veins, right, so they have used up all the oxygen. Correct? Spleen is for our immunity. Right? It has got a very powerful immune function, fighting against the pathogens, right? Bacteria, whatever. So anything goes wrong, so it is just the spleen is like a headquarter. So when those WBC cells, the first line of defense, when they go, they fight, they send the messengers that we can't handle this attack, and then the spleen starts, and spleen keeps on working. Right? Any of those weak, improper RBCs, etc. Right? Yes. It is like a graveyard of RBC. Exactly. It slaughters them. Can't down, right? Because in our body, only best of the best, all those bouncers, they should be moving. Right? So it is one of the very powerful. It has got that, it is called as the pulp, red pulp and white pulp. Right? We'll discuss in detail. So here it is, the hepatic artery, portal vein, right? So these are the two things. So important is hepatic artery will be giving oxygen, ke le beta kha and kaam kar. Portal vein will be giving ki ye mera kaam kar, right? So portal vein will be giving the job, and hepatic artery will be giving the salary. And liver works. But liver is like a very sincere person, right? What liver tells, no, not only this much, right? Here is my cousin, and that cousin is bile. This cousin is gallbladder. So liver makes bile, and that bile is stored. It's called as bile. Right? So whenever you eat those pakoras, right? Whenever you eat those say barabar double cheese pizzas, right? So all those things are digested by this bile, right? And this bile which is sitting over here, this gallbladder which is sitting over here. So there is a duct, right? That common bile duct which is over here, and from here the bile duct will be coming, and it opens into this second part of the duodenum, what is called as the ampulla of Vater. And interestingly, over here there is another important organ, and that is called as the pancreas. So pancreatic duct will also come and will open over here. So this is the pancreas, right? Because pancreas will be releasing that insulin. So that would be needed. Pancreas will also be releasing, because pancreas is two types, because pancreatic juices, they will be helping in the digestion, and this endocrinal part of the pancreas, that is the release of insulin, that will be released into the blood. So it releases two types of secretions. So insulin, when the body will say, in fact, there are sensors into the pancreas. So they will say, itna sara sugar, right? Put it back into that. Then they call the call to the liver, bharo inko wapas apne to that, right? So the glucose that is stored into the liver, so that unnecessary glucose should not be running into the blood, because glucose is one of the best culture media for the proliferation of bacteria. Plus, there are so many other complications which we'll be studying in diabetes, right? When we'll be discussing the diabetes. So this bile which opens over here, this bile which comes over here via the gallbladder. So this is also going over there. So these three, hepatic artery, portal vein, and the bile duct. What you have learned is, it is called as the porta hepatis. Very common question, especially for the Viva. Right? But this is the thing, because there is a common space through which three things will be there. And in dissection, we'll see that yes, a big, perfectly round, that is the hepatic artery, because its caliber will be round, big, thick. Portal vein, because it is vein, so it is compressible. So that's why the portal vein would be looking something like this. Artery will always be looking like this. We'll see it in CT scan and also the ultrasound. And the bile duct, which is relatively small. Right? So that's how this whole thing is called as the porta hepatis. I'll just write it over here. The porta hepatis. Now, when such wonderful mechanism is there, what about the baby? All these things should work. So, our next is what baby would do. So here is, so this is all clear. So here first. In today's session, yeah, there will be hardly anything we'll write. Everything is in the form of these images only. So now that's the placenta. Right. And the gift from mother has arrived, and that is oxygen. Now let's consider this side is that baby. So this is the abdominal wall of the baby. Now how the baby is connected? By that umbilical cord, correct? By that umbilical cord. It is called as the umbilical cord. So this cord is like a pipe, and in that pipe there are several structures. Okay. This particular file will be saved, right? Don't draw anything, don't write anything, just focus. In case of any problem, ask. This file will be saved. All the files are saved, and just note this email address, right? And send a mail to me. I'll send you the link. Okay. Yeah, it is tillur@gmail.com. At the end, I'll show you the email address again. Anyone, if you have not noted. Sorry. So coming back to this is the umbilical cord. Now we are drawing only one component of the umbilical cord right now, because by the end of our today's discussion, we'll be understanding every component of umbilical cord, right? So here it is, the umbilical cord. There is one vein which is going, and that is umbilical vein, right? So simple name, umbilical vein. How many veins? Only one vein, right? Because umbilical artery, when they will be coming back, right? When we'll complete the entire journey and when we will be coming back, there would be more. But right now there is umbilical vein, so there is only one umbilical vein. This vein, we called it vein. Why? Because now everything will be discussed with reference to the baby's heart. That baby's heart. So as if we are sitting, as if we are the baby, right? We are the baby and we are receiving the blood. So that blood is coming. So we'll be calling it vein. Everything is in with reference to baby's heart. So this is the umbilical vein. And this umbilical vein will be having oxygen, bilkul, rich. It is coming straight away from placenta. And this placenta is very much vascular. Is very much vascular. Keep this word in mind. If the, I'll explain it over here in very brief, but because it is so important. Here is the uterus. Yeah, here is the uterus. That's the cervix. Now, the placenta, when it is over here, and the baby is here, right? Baby is here. It's developing, and the placenta and the cord is connected. If this placenta, this particular placenta, if it shifts over here, right? It can shift like this, or sometimes it is only partially like this, or sometimes it can cover full. This is what is called as the placenta previa. The important is that as the uterus enlarges, right, and if it is said that if there is bleeding per vagina, if there is bleeding, and if on ultrasound you detect that this is the placenta previa, that means you can't even attempt to go for a normal delivery. Because if it is done, then this ruptures, and if it ruptures, then the bleeding will be so high that the baby would be compromised within seconds. Because for baby, this is the only connection. Umbilical cord is the only connection. So this placenta should not be, say, removed. It should not get extruded under any circumstances. Right? It is the only connectivity between mother and the baby. So then later, as we'll discuss, right, I'll show you some of the ultrasounds, right? Because you just put one probe and you say operate. right now, right? Within minutes, you say that deliver the baby. Even if the baby is premature, no problem. Put that baby into ventilator, but no way you can really let that pregnancy continue. So this was one of the reasons, placenta previa, a very difficult thing to handle, manage. Okay? But the keyword is vascular, because it is very vascular, not vascular, very vascular. Its blood supply is very heavy. That's why it bleeds pretty heavily. Right? So here it is. So that placenta, right, that umbilical vein, it is giving that oxygen, and that oxygen, now here is the entry, that it enters into the baby. Now that's the liver, chota sa liver, right? But important. You know? And in that liver, baby will be having what? Baby will be having must small spleen, and there is a cute portal vein which is going, you know, and then babies, all those, right, mesenteric veins, everything is there. This umbilical vein, it enters, which is the color over here. This umbilical vein enters and it divides into two. Right? It divides into two. This one, which is called as the right umbilical vein. Right? It will be having oxygen, and it gets connected to this portal vein. Right? And it goes into the liver. The liver is happy. Oxygen, right? Oxygen. So it will straight away use that oxygen. Entire oxygen used up, right? Nothing left for the body. So that's why mother must have said that she is smart, that umbilical vein, go and divide it into two parts. So right umbilical vein, it supplies to liver. Left umbilical vein, which is also having that oxygen, it tells that if I give it to liver will use it up, right? So kuch nahi dena, right? Left umbilical vein is waiting, and what it is doing, liver will put, because he will use that oxygen. Rest of the things, right, it will be utilized, and it will be coming out by hepatic vein, right? We talked about it. Okay, yahan pe we talked about it. Here it is. This is the hepatic vein, right? So from hepatic vein, it goes to inferior vena cava, right? So we are drawing it. So here is the inferior vena cava, big one, right? Here is the IVC. It goes to inferior vena cava, and then from inferior vena cava, we saw that entire journey, that it goes to right atrium, to right ventricle, to lungs, to left atrium, left ventricle, and finally to the entire body. It goes. So things are on the track. But what? Where is the oxygen? No oxygen, right? It is this left umbilical vein. It goes and it lands into inferior vena cava, right? So now, what has happened? That oxygen from here, it has gone into the inferior vena cava. Now this is like a special path. This path. Normally we won't, in our body, your body, my body, we won't be having this. But yes, at the end we'll see that what would happen to this. So this is, right, this portion, which is gracefully giving this oxygen, chura ke, right? Not sending it to liver, but then it is putting into the inferior vena cava, and this is called as, it is a sort of duct, right? Duct. So it is the ductus venosus, because it is a vein, na? Venosus. What happens if the baby gets jaundice? All those pathologies later, right? Yes, baby can get jaundice. In fact, there are so many things. One of the things what is called as the erythroblastosis fetalis. Nothing happens to the first baby, and second baby severely jaundiced, especially when there is a blood mismatch, when the mother is negative, and then so many complications. Okay, so coming back to this is the ductus venosus. So it is called as the ductus venosus. This is one of the first important thing which has developed. But you will agree to that here is the inferior vena cava. Now we are focusing on inferior vena cava. Right? From the liver, the hepatic, right? Those hepatic veins. So those hepatic veins, there is no oxygen. In fact, it is, yeah. So in fact, this is the oxygen, right? And this one, which is the ductus venosus, which is giving this oxygen. So over here, we are getting mixed blood. It is a mixed blood. So throughout the life, baby would never ever be getting the pure oxygenated blood. Baby has to grow, baby has to survive with that mixed blood. Now this is injustice. You know? This is injustice. When baby would say, when I need the most and you are giving me this mixed blood. So that's why God said, okay, don't worry. I'm giving you a special hemoglobin, and it is called as a fetal hemoglobin F. Right? Yes, Arya, wait for a minute. Right? Just I'm coming to this point. Right? If you see till this point of time, till this point, right, we have not, lungs have not come in between. You know? Lungs have not come in between. Here straight away we have picked up the things from liver. From liver, it is the hepatic vein to IVC. You know? So, right? So what mixed blood? This you have understood? Oxygen from hepatic vein, because this is the liver. Liver has used this entire oxygen, right? But yes, against that, liver has given some nutrition also, and those things are put it into the IVC. You know? They are put into IVC. And this is the ductus venosus, which is the special route which was coming from that umbilical vein, which was dividing into right side and the left side, and it is this left side which goes into the ductus venosus, and via that ductus venosus, right? That oxygenated blood has reached over here. Now, because it is a mixed blood, if it is a mixed blood, that means there is less oxygen. How tissues will be handling it? How it will be carried to the entire body? And that's why God has given special hemoglobin, and it is called as the fetal hemoglobin. And this hemoglobin has got tremendous affinity for the oxygen, much more than the adult hemoglobin. There are other two hemoglobins, hemoglobin A, right? Hemoglobin A, B, those are the adult hemoglobin. This is the fetal hemoglobin. So fetal hemoglobin, because it has got higher affinity, very efficient. So even with this mixed blood, it tells no worries. Itna oxygen will deliver it fast to the tissues. Right? So that's the beauty of the system and our mixed blood. Right? Because now we are baby. You know? So that mixed blood has reached to our heart. So here is our heart, right? And the inferior vena cava, it lands over here, right? No doubt, it will be landing from below, but this is for understanding, right? So this is the inferior vena cava, which enters into our right atrium. Right? So superior vena cava will also enter, but this is the game right now only for inferior vena cava. That's why I'm not drawing superior vena cava, not to confuse you unnecessarily, right? Right now, just flow with this system, right? And at the end, all of your answers, all of your questions would be automatically answered. Okay? So here is the inferior vena cava. Blood, the blood has reached. That oxygen has reached to right atrium, right, from our mother. And here is the tricuspid valve. Chota to chota, but apna valve to hai, right? So that valve, and this is the right ventricle. Happily, right ventricle. From here comes the pulmonary trunk. pulmonary trunk, and from pulmonary trunk, here are the lungs, right? But those lungs, they will say, why have you come here? Right? There is no space. We are filled with fluid. So pulmonary trunk, what are you doing? Why are you coming here? Right? Block. They'll say that you just can't enter because we are fully filled with fluid. Right? There is no space. There is no air. There is nothing for you. So go back. Now we are stuck. Right ventricle would say, now what to do? Here comes the another thing. Drawing only the heart now. So here is the right atrium. That blood with oxygen, it has entered. Now there is no point in sending the blood to here and here, because lungs, they say no, right? We don't have nothing. So that's why there is one opening. There is one opening. This is, yes, that's right. This is what is called as the foramen veil, right? Foramen, right? This beautiful hole, which is between right atrium and left atrium, correct? So if we really want to name this wall, so can we name this wall as interatrial septum? That is in between atrium, interatrial, that is between two atria, and the septum. This is the wall. So in this wall, there is a one hole, and that is called as the foramen. Foramen means hole, and its shape is oval, so it is called as foramen oval, right? Simple name. So blood happily goes into, it comes into the left atrium. It has bypassed that lung. So in other words, it has bypassed, right? We'll write it over here. It has bypassed pulmonary circulation. Pulmonary circulation. And pulmonary circulation, you know it very well, that it is for the gaseous exchange. So it has bypassed it. And from here, the journey is cool, right? Here it is the mitral valve. Mitral valve tells, come on, welcome. And here it is the left ventricle. From left ventricle, chalo, right? Onto the aorta, and our flight is ready, right? Onto the journey to the entire body, and it goes, right? Entire body, all the tissues, they will be getting the blood. So this is one of the another interesting thing, apart from umbilical vein. And then the second thing which we saw very interestingly, that was the ductus venosus, because it is this, say thanks to ductus venosus, right? That's why this oxygen has been received. Otherwise, so liver has consumed everything. And it comes over here, and the life is good, and then the through aorta, entire body gets it. Can a blood flow from lungs in fetus? No, right? But the answer is, as I said, no, but there is one very interesting reason behind it, right? You'll love it. But you know, some of the blood, right? That is notorious. It tells, nahi, bas jaake to dekhte, right? And that blood trickles. Right atrium to right ventricle, जगड़ के pulmonary trunk नहीं देखते तो हैं, right? Let's go. So it will come out of the pulmonary trunk, and then pulmonary trunk tells, and then there is a roadblock. नहीं है. So God said that you are wasting this much precious blood, itna important blood, right? Because every drop is important. Create a new duct. So a new duct is created, and that duct goes from, now this is a schematic, right? Itni badi length, it is not this much length. Later on, I'll show you that the ductus arteriosus, right? It is very small, but right now we are just understanding the flow, right? So this is the answer, right? So from here, there is a duct, right? It is the ductus. It is between what? It is between pulmonary artery. So it is artery. Aorta, it is the biggest artery, right? So from it is connecting two arteries. So that's why it is called as ductus arteriosus. Ductus arteriosus. Look, my lecture is in progress. So it is the ductus arteriosus, right? So it is which is connecting pulmonary artery and the aorta. So fetal lungs are filled with fluid. Then is it removed after delivery? No, it is God's grace. You'll see that how it is removed. Right. Very interesting. So ductus arteriosus. So this is one new development. One more new development, right? That is the ductus arteriosus. So we have seen till this point of time how many things? Right? We understood one, the umbilical vein, the right umbilical vein which was going to liver, left umbilical vein which was opening into IVC, infra vena cava. But there was, that was the what? It was the ductus venosus, correct? Venosus, because it is between vein, umbilical vein and the infra. Is it possible that placenta is all over the womb, or is only on a small portion? It's only on a small portion, right? So this is the uterus. Only the portion it is covered, because its development is like that. Right? We'll see later in embryology. We'll see that how the placenta develops. So it will never be like this big, right? It is impossible. It is, when you'll see the mechanism, it is impossible. It can never be that big. Sometimes it is bigger, but the important part is that if this is the uterus, these are the fallopian tubes, right? And if this is the cervix, the important thing is when it encroaches this area, because this is the like a birth canal, that should remain, that must remain open. So if it encroaches, so if it is partial, so then it is called as the partial placenta previa. In partial placenta previa, depending upon the situation, depending upon you need to do ultrasound previously. So when it stretches, so at times you can negotiate, you can manage it. There will be some bleeding, but doesn't matter if the baby is delivered within time. And then the umbilical cord, right? That is the umbilical cord. One forceps here, second forceps here, and then in between it is cut. Right? We'll see by the end that how the placenta is delivered. So once the baby is delivered, then that umbilical cord, it is gently pulled, and then with a gush of blood, the entire placenta comes out. The whole of the placenta must come out, right? And then it is examined that if it has come out, and nothing is to be left. And then miraculously, the entire uterus starts shrinking at a very rapid rate. Even during this, we'll also be discussing that once, say, after pregnancy, why it is necessary that female must do some of the exercise, right? So some of the things, if they are ignored, so then you will see that female, as such, the whole structure, she is very beautiful, but with that extra tummy, especially the post-delivery, right? And if you see all those celebrities, you'll find that how come they are having such a flat tummy even after delivering two babies? And it is a matter of some time, important time. So many questions. After umbilical cord is cut after birth, all the oxygen is delivered to the baby, right? I mean, when the umbilical cord is cut, then it is the time when baby should start breathing, because now there is no one to give the oxygen to that baby. What happens if some of the part is? No, it has to be removed. It has to be removed. Because that placental tissue, after that, it has got no use. Exercise must be for readjustment of the stretch muscles. Absolutely, you're right. Absolutely. Okay, so this was the ductus venosus. Right? So here it is. This is one The ductus venosus was the second thing which we learned. Third thing which we learned was the foramen ovale, right, which is onto the interatrial septum. And then we learned about the ductus arteriosus, right? The ductus arteriosus, which is the connectivity between the pulmonary trunk and the aorta. So these are the so many, right? You can imagine, right? So many things they are coming up into the fetal circulation. Now, still the journey is not complete. We now pick up from aorta, right? So now our journey is continuing from aorta. Because what has happened to the aorta? Well, in case of aorta, the blood has come, the mixed blood has come from the left ventricle, right? From the left ventricle. Now you might ask question that what about the blood which is returning from the body? Coming to that, right? But right now, what blood we have received? The blood which was sent from right atrium via foramen ovale to left atrium, to left ventricle, to aorta, right? To aorta. So this is the blood which we are receiving, and the blood which was sent by this is the pulmonary. This was the pulmonary trunk, and from pulmonary trunk there was one duct, and that was the ductus venosus, ductus arteriosus, right? Ductus arteriosus, and that was giving the blood. Basically, whether the blood is from here or here, it is the mixed blood only, right? Because the blood has been mixed right from the beginning. So here it is. Now the journey starts from aorta. So here it is. This aorta, which supplies blood to the entire body. Because now, when the aorta is there, so here starts the complete thing. This is the aorta, right? In that aorta, we have got the left subclavian, right? It is called as the left subclavian, which will be supplying all the way to the upper limb. Then there is left common carotid artery, which will be dividing into external internal, and then there will be vertebral artery, which will be forming circle of Willis, that is, it will be supplying head and neck, brain. And on the right side, this is what is called as the brachiocephalic trunk, right? And then that brachiocephalic trunk will be giving the one branch above, and which will be called as the right common carotid artery. And then this thing will be continuing as the subclavian artery, that is the right side. And this subclavian artery, then it will move further, becoming axillary, and then going all the way to the upper limb, right? So no worries till this point. And this is what is called as the arch of aorta. From arch of aorta, now this blood is going everywhere. From this arch of aorta, it will go down, and this is what is called as the thoracic aorta, right? Thoracic aorta. So till this point, we are into thorax, right? This is thoracic aorta, and then there would be the diaphragm, right? And as we cross the diaphragm, we go below, and now we'll be calling it as abdominal aorta, right? And this abdominal aorta will be giving blood to digestive system and everyone. It comes down all the way, and then it divides. Because this is normally also it divides, right? So it divides, and it divides into common iliac artery, right? Because it's the common iliac artery, right and left. Then once again that common iliac would divide it into external and internal. So thus this aorta, which was going all the way from the top, it goes down and it divides. Now when it divides, right, in the form of external iliac artery and internal iliac artery, same thing would happen on both the sides. So this is the right common iliac artery, right? CIA, common iliac artery. And similarly, this one would be the external iliac artery, and this one would be the internal iliac artery. This external iliac artery, this side, external iliac artery, this side. Right? They continue. Even in our body also, it would be like this. They continue as femoral artery, right and left, right? Femoral artery. And it is this femoral artery which will go all the way and will supply the lower limb. Right? Supply the lower limb. This one will also supply the lower limb. And then the circulation will be returning from there. But what about this internal and the internal, right and left internal iliac? This right and left internal iliac, right? I'm changing the color. Right and left internal iliac. They will reach to umbilicus, because see, now this is the lower area, right? This is the umbilicus. So that aorta which was over here was dividing, so that via umbilicus they come out. So here is umbilicus is what? Umbilicus is that umbilical cord. So these two, this one and this one, they are coming from heart. Correct? They are coming from heart. So we'll be calling them right umbilical artery. And this one is coming from left side, so we'll be calling it left umbilical artery. So it means this particular portion, this is a special adjustment. In our body also there is internal iliac artery. It is not so that it is only these, but then they will change. We'll see that. Right? So here is the umbilical artery, and these two umbilical arteries, they will be going where? They have to go all the way into the placenta. Right? And they will be having large amount of CO2, right? Because it is there. But again, mixed one. Some oxygen will also do, but definitely mixed. So if this is the body, the wave, right? So over here, what we are watching is this portion. This is umbilical cord. It is in this umbilical cord. This would be the cord. This would be the connectivity between us and the mother. This one would be the connectivity. And it is in this connectivity only the umbilical artery will be. And that's why, right? You know, females, they are so efficient the way they make that choti, right? So there are 3 strands, right? 1, 2, 3, 4, right? The way we can, as a male, we can just do it like this, right? So it is something like this, that choti, right? But it is that literally those 3 strands which are winding around each other. Same way, in this particular thing, there would be 1 umbilical vein and 2 umbilical artery. They are there, right? And then they are winding around each other and they are making a cord. Now this particular cord is delicate, so it has to be covered. Right? So then it is covered by a very fine jelly. So that these vessels, they are not damaged. Right? And that jelly is called as the Wharton's jelly. Wharton's jelly. And don't at all underestimate this jelly, right? It is one of the very fine thermoregulator. It controls the pressure, it controls the temperature, right? It controls the caliber of this, so there is a fine adjustment, right? How much oxygen is needed. So many things about the Barton's jelly, but it is like that. Once this choti is made, right, and then this particular choti, it is wrapped into a very fine jelly, right? A very fine jelly. This and that jelly and this whole thing is nothing but umbilical cord. So that cord which is long and it goes into the placenta. Right? So that is like a connectivity between us and the mother. Okay. Now, there are two things which are left out, and those things are superlative. The question which you asked is, right? I think, oh, you asked. I think, yeah, but so it has gone up. But yes, I remember it asked. The question is, this is one of the important concepts. And the concept is that in our lungs, there is one mechanism. And that mechanism is, if there is no oxygen, don't waste the blood. Mat pejo. Right? Because see, this is alveoli. This is alveoli. Alveoli is important for the oxygen carbon dioxide transfer, right? Very royally. But on top of it, who will be doing it? There would be the capillaries around the alveoli, right? So these are the capillaries. These are the capillaries, pulmonary capillaries, and they are responsible for oxygen, taking the oxygen from alveoli and giving the carbon dioxide to them and telling them that breathe out this carbon dioxide. This oxygen is important because in presence of this oxygen only, these capillaries will remain open, right? Understand it, that in presence of oxygen is needed to keep these capillaries open. Otherwise, it is called as if there is less or no oxygen, so that leads to one of the condition which is called as the hypoxic. Hypoxic means less or no oxygen. Pulmonary. This thing is only into pulmonary system. It is not into the systemic circulation. Vasoconstriction. Vaso means vessels. Constriction means it narrows down. Right? So, when there is pulmonary, in case of lungs, when there is no oxygen, so these vessels, they would shrink. Once they will shrink, right? So no blood can go. So this is exactly what really happens. You know? This is what really happens because the whole thing is filled with fluid. Right? Whole thing is filled with fluid. So then what's the point, right? If there is only fluid, so that means there is no oxygen. If there is no oxygen, so then because of this mechanism, because there are specific receptors which are by the oxygen sensitive receptors. So they keep the capillaries open. So if it is not there, so then because of hypoxia means less oxygen. These pulmonary vessels, I'm talking about these vessels, they will shrink. If they will shrink, that means blood will not be allowed into the alveoli. Alveoli means into the lungs. This is the reason the blood which was trying to come, right? That there was the pulmonary trunk, right? Pulmonary trunk. It was trying to send the blood, but then those lungs said, where will you go? If all the vessels, they are shrunk, they are constricted, right? Everything is locked. You can't go. So that's why it is diverted via ductus arteriosus to aorta. Now it is clear that why no blood will go into the lungs. It is because of this mechanism, right? Think it now slightly at a higher level. What would really happen, right? Our heart, right? We are here. This is that foramen ovale, right? And the right ventricle is over here. And the pulmonary trunk is over here. And when pulmonary trunk tells nahi, they are not allowing the blood to go into the lungs, right? Mana kar diya, na bola. It said no, can't. So right ventricular pressure would rise. Our right ventricular pressure would rise. That right ventricular pressure, as it would rise, it will lead to rise in the right atrial pressure. That pressure is rising. Correct? That pressure is rising. Now see, so much of physics is also involved. Still, there is some chemistry is also there, right? But now we are talking about the physics. So right ventricular pressure, that right ventricular pressure will lead to right atrial pressure. Right atrial pressure will, and then there is a space, foramen ovale. Maro thakka, right? Push the blood, right? Left atrium. Left atrium is bichara seedha sa. Right? Left atrium would say, I can't do anything, right? My pressure is not that high. So right atrium will push the blood. So large amount of blood will go. This is because of the back pressure. Because this path is blocked, right? And then it goes to left ventricle. Left ventricle will do the normal function and aorta, right? And then the ductus arteriosus, right? It will add more blood, and that will be carried to the rest of the body. So that's how things they are really moving. Now, in case if you are wondering that this ductus arteriosus, right, we are making it that big. The size of the ductus arteriosus, actually speaking, it is very small. Right? If this is the arch of aorta. This is how this goes. So it is only this much. That's small, right? It is only this much small ductus arteriosus. Next time I'll show you the real picture also. Those who have already, in fact, if you go back through our old PDFs, you'll see that even the real dissected this portion is also seen. But just to let you know that it is this much portion, ductus arteriosus. Now, there is one important and very interesting thing about the ductus arteriosus. Ductus arteriosus remains open. Right? One thing is because the blood is going, so it is the pressure. But there is one more interesting thing, and that is why placenta, right? Placenta, mother is so intelligent. Mother is knowing that for my baby, right, to survive this ductus arteriosus is important. It is important to keep it open. So she will release prostaglandins via placenta. So these prostaglandins are something, you can say that it is a chemical which is keeping the ductus arteriosus open. Right? It is keeping the ductus arteriosus open. So I'll just write keeps ductus arteriosus open in capital. So important. Right? So life is set, right? Now let the days pass and right, we are becoming bigger in size, maturing, all good. And then comes the final day, right? The day on which we are supposed to born. So here is we take birth. Now, when we take the birth, till this point, there was no problem. Everything was coming via the umbilical artery, umbilical vein, and it was taking care of it. Now comes someone slaps us, right? And we cry. And we cry full-fledged, right? With big tears, right? Itne jor se mara, right? But with this first cry, what has happened is, crying is, when we say air, right? So then such large amount of air, and that air, it literally gushes into the lungs. And that thing, it would displace all the fluid. because it is that. So that fluid, it will start getting absorbed into the lymphatics, and it will be literally pushed because such large amount of air is going. So in the alveoli, as this air goes, oxygen goes. So first thing, what would happen? As this air, this is like alveoli. Till this point, all those capillaries which were like all vasoconstricted, right? There was constricted. Suddenly they open, right? They become big. Right? They become big. There is no vasoconstriction. Why no vasoconstriction? Because oxygen is there. Now, in the presence of oxygen, so in the presence of oxygen, there is no vasoconstriction. So what we were discussing was hypoxic pulmonary vasoconstriction gone because oxygen is there. So in presence of oxygen, those vessels, they would dilate. When the vessels would dilate, something miraculous happens. So these vessels, pulmonary arteries, right? To be specific, these are the pulmonary arteries. Branch, right? They dilate. So they were coming from where? They were as such, they were from pulmonary trunk, right? So now the blood has started going into the pulmonary trunk. To then right ventricle, which was under so much of pressure, the blood is not going, right? It's getting accumulated. Right ventricle is relieved. Blood pressure drops. Because now the path is open. Now the blood can go freely into all the lungs. So right ventricular pressure drops. Now right atrial pressure drops, right? Because it is the back pressure which is taking. So all the way the pressure has dropped. Now when the pressure has dropped, something happens over here. So this is like, now I'll draw only our partial heart, right? So this one is this one, right? So you know this part, right? This is the right atrium and this is the left atrium. So this right ventricle, now the pressure has dropped, right? So blood which was going over here, and here we'll just say that lungs are open, so all the pressure have dropped. Now, if the pressure over here drops, and meantime, left atrium is at normal pressure. So when the right atrium pressure starts dropping, the blood which was going through this foramen ovale, previously it was high pressure, so it was gushing. Now the pressure has decreased, right? So less blood. Pressure is still decreasing, lungs are opening, right? The pressure is still decreasing. At one point of time, left atrial pressure becomes more than the right atrium. Right? Now, we said this as a foramen ovale, right? We just drew it like this for our understanding. But in reality, how it is exactly like this. I'll draw it over here. It is exactly like this. Like this. Right? These are called as the primum septum and the primum secundum. Right? We'll see that thing in embryology, but they are called as the primum. Primum means these are the layers. So first layer is there, then the second layer is formed. Right? So this is the primum. This is the septum primum, and the septum secundum. Primary and the secondary septum. Right? So this is the primary, this is the secondary. So over here, one layer is formed and then the second layer gets formed. But because the blood which was under pressure, so that's why blood was trickling like this. So here it is acting like a wall. But then as the pressure of the left atrium rises, it shuts. As it tries to go back, right, it shuts. So it goes something like this, right? It goes something like this, right? Like this, because it is overlapping. So this is, the pressure will shut it down. So now right heart and left heart, they both are separate. So the point is that foramen ovale, right? Foramen ovale, it closes because of physics, right? Because of pressure difference. Pressure difference. Right? So over here, right, you are talking about this. Right? This is one septum. This is one septum. This is another septum. Before birth, the situation was that septum remains there only, like this only. Right? But before birth, it was like this. The pressure over here on the right side was high, so that's why the blood was trickling on the left side. After birth, right? After birth, the pressure is over higher. So this flap which was loose and the blood was going like that. But now the pressure on the left hand side has increased, so it will just close it. It won't allow the pressure from this side to go on opposite. Right? You are getting it? This is like a one-way valve. One way, right? So this is one way. That's why when we'll be studying embryology. So in embryology, if these flaps, they are not developed properly, right? I'll show you the real ultrasounds also. So if this flap is small, right? Let's say if above flap, right? This septum, this is small, and this is like this, right? Here is the primum, here is the secundum. They are smaller. So that means till birth, no problem. Because in any case, this foramen ovale is there. But after birth, it will remain open. Because this flap, it should really close it. Right? It should really close it. It is unable to close it. And then as the pressure keeps on, because now the left atrial pressure is always high, so it will keep remaining it like that, and then they fuse with each other. They fuse, but when you'll dissect, you'll find that some portion will be seen, that once upon a time there was a hole, right? And that thing will look like a depression, and that is what is called as the fossa. Fossa means khada, right? Fossa ovalis. So fossa ovalis is the landmark which tells that once upon a time when you were not born, right, this was the portion from where the blood was going from right atrium to left atrium. If it persists after birth, right, maybe because of some, right, maybe say this is when the hole is there, right? So this particular thing is when they say कि heart में hole hai, it is this. It has to be blocked, right? So this is what we'll be studying into the congenital heart disease. So this is clear that how this foramen ovale is closed. That is called as the AS, atrial septal defect. Right? Then there are various above and high atrial septal defect, low atrial septal defect. These are the endocardial cushions and so many things. Great. Still, one small thing which is left out, and that small thing is our ductus arteriosus. Right? Our ductus arteriosus. So right atrium, to right ventricle, to pulmonary trunk, and now the pulmonary trunk is boss, right? It will say, okay, over to lungs, right? Happily. But then aorta will just say, अच्छा, इसका क्या करना है? Ductus arteriosus. Ductus arteriosus. So you say close it, right? So aorta will say, yes, we have to, because now my pressure is high. So the blood starts going in the reverse direction. You're getting it? Because now the aorta is under high pressure. Pulmonary system pressure is never that high. Aorta is a powerful pump, right? So that pressure is high. Up the situation was because of the lungs, they were blocked. That's why right ventricle was under pressure and the blood was getting pushed into the aorta. Now the blood is going towards the lungs. So this is what is called as the temporary reversal. Reversal of shunt. Temporary reversal of blood from aorta to the pulmonary trunk. So it is temporary reversal of shunt. Why? Because ductus arteriosus is open. We need to close it, right? But it is under the control of prostaglandins. Prostaglandins is by what? Prostaglandin is by placenta, right? So placenta, it is secreting those prostaglandins, right? Prostaglandins. So these prostaglandins, as the placenta goes, prostaglandins stop, but prostaglandins is not like an electronic switch, right? It is a chemical switch. So as it is stopped, so it takes some time for the ductus arteriosus to get closed. It takes some time, right? While foramen ovale, it the moment first cry and immediately shut, very next second. And that's it. It will remain shut for rest of the life. And so much so both of them will fuse. And if the heart is seen from the right atrium side, we'll see that, okay, there is a fossa ovalis. Right? But this ductus arteriosus will take time. It will not shrink immediately. It takes time. Right? In few days, right? 3 or 4 days, it shrinks. But yes, it shrinks. Ductus arteriosus shrinks. So if it shrinks, then it becomes what? If it shrinks, right? So now it has become like a tough structure, right? A tough structure, and that tough structure is called as ligamentum. Ligamentum arteriosum. So that's ligamentum arteriosum. This is the reason when we'll be dissecting it. Yes, you see that yes, there is a fibrous type of connectivity between pulmonary trunk and the aorta. So which tells that once upon a time there was this ductus arteriosus. Now we come to the last point. Here is the aorta. That aorta which got divided into two parts, right? The common iliacs, right common and left common. That common iliac was dividing into the external and the internal one, right? Same way over here, internal one, right? And these external, you know that they go into the form of femoral and they supply all the way to the lower limb. Fine. They were going to in the form of umbilical arteries, right? Umbilical artery. They are going from heart, right? So that was the right umbilical artery and the left umbilical artery, and then there was vein also, and this whole package, what we call as the umbilical cord, and that was going to the placenta. But now you have put two clamps and we have cut it. It has been cut. This has been cut. That is the reason that after birth, right? Say if this is the wall, abdominal wall, so then this much portion, the portion which has been cut, right? This portion, after a few days automatically it disintegrates, right? And it sheds. But what about the internal part? What about this part, the arteries which are inside, right? I'm talking about was our beginning of the journey, the umbilical vein, right? Umbilical vein, and that's the umbilicus. Inside it divided into two parts, right? They become part of what? They become part of superior vesical artery, right? The artery which will be supplying to urinary bladder, right? So these are the umbilical arteries. That's the fate of umbilical artery. So that portion is also stopped. Right? Coming back to this is the most interesting, which was dividing into two parts, that is the right one and the left one, right? Left umbilical veins. This which was going into the portal vein, right? And then it was going into the liver, right? That's what it was getting supplied. So this is going into the liver. So here it is, because now that is also not needed now. This one is also not needed, this portion. What to do? Because now there is no need. So this portion, when we'll be doing the dissection, right? When we do the dissection of liver, you'll find that there is a structure on the right hand side, and it is called as the round ligament of liver, right? Round ligament of liver. R for R. Remember it like this, right? Right side, it is round ligament of liver. So round ligament of liver is nothing, but it is the fibrosed portion of the right umbilical vein. Here, next one. What about the left part? Left part was going all the way, and it was landing into inferior cava, and we know that its name was ductus venosus, right? That was its name. But now he is also not dead. So this is also fibrosed. Once it is fibrosed, then we need not call it duct, right? So now it would be called as the ligamentum. So it would be called as the ligamentum venosum. Ductus venosus, that has converted to ligamentum venosum. Again, God's grace, easy to remember. Left for left, L for L, so that you never ever commit mistake if it is asked in exam. And people find that this thing is so complicated, right? That question which is asked, that round ligament of liver, it is a remnant. Remnant means in past it was there. Round ligament of liver is remnant of right umbilical vein, left umbilical vein, right umbilical artery, or left umbilical artery. First of all, there is nothing like right umbilical artery or left umbilical artery, right? And R for R, it is round ligament of liver is remnant means bacha hua, last portion, that is of right umbilical vein. Easy. And the ligamentum venosum, again the same type of question. Ligamentum venosum is remnant of right umbilical vein, left umbilical vein, right umbilical artery, left umbilical artery, nothing L for L, right? This is the ligamentum venosum is because of the left umbilical vein. So this is what really happens before and after birth. So in summary, because this comprises of so many questions in any of those competitive exams. So things which are before and things which become after birth, right? So over here, right, foramen ovale, let's take it like a test. Foramen ovale, after birth it becomes what? How many are still there? 57, half. That's fossa ovalis, perfect. Fossa ovalis, very good. Second question. Ductus arteriosus. Ductus arteriosus. Ductus arteriosus is between pulmonary trunk, correct? Pulmonary trunk and the aorta. So it becomes, that's right, it is the ligamentum, correct? Everyone is correct. Arteriosum, correct. Okay. umbilical artery, right. Umbilical artery, right. It becomes what? Swati trapped. Deepnita trapped. Ajatshatu trapped. Arey mere dost, right umbilical artery and the left umbilical artery, they become this. Part of superior vesical arteries which will be supplying to urinary bladder. Correct? This is umbilical artery. Right? This is umbilical artery. Clear? Right? Okay. So, umbilical artery, whether it is right or left, right? It was asked deliberately, right? Whether it is right or left, they will become part of superior vesical artery. And that superior vesical artery, which will be giving partially blood to urinary bladder. Right? Urinary bladder has got a very rich blood supply, but this will be giving to urinary bladder. So that thing is done, right? And now the things are easy. That is the, what about the right umbilical vein? So when we say right, it should be easy. That's right. Now you are right. It is the round ligament of liver. Okay. And finally, we have got the left umbilical vein, and that would be ligamentum venosum. Very good. Ligamentum venosum. All right. So, happy birthday to everyone. So that's it for the today. Any query, anything you want to ask, you can. But this is one of the very important concepts. Once you know this, any question asked from the fetal circulation, you'll close your eyes and the picture will come in front of you. You'll be able to answer all of them. So many questions they come from it. Book, this is like in no book it is. As such, it is given in all the books. You'll see it even in anatomy also. But if you understand it like this, so you'll never forget it. As such, it is given in Gray, Chaurasia, Guyton, any book you pick up. This is something which is part of anatomy as well as the part of physiology. So you'll find it in both the books. Akshat, any question? Don't write anything. Right? I'm just, that is the email address. It is still URLBS TILLUR. Send them just a hello message on this, and I'll send you the link. Done? All right. So, thank you so much. This is in fact one of my favorite topics because every time you keep on thinking that God is so intelligent. I mean, such amazing principles. All right. Thank you and take care. See you next time. Yeah, very interesting. No doubt about it. Thank you. For now, for time being, right now, there is no change in time. Day after tomorrow, we'll be meeting at the same time.